Hi, everybody. Welcome, and thank you for joining us for closing the gap in preparing veterinary graduates for real-world practice. We're asking really one big challenge at the heart of veterinary training. Are we truly setting students up for success after graduation? I'm Christy Chori. I'm an account executive at Enflux, and joining me today are three leaders working in the intersection of education, practice, and technology. Dr. William Tancredi is the founder and owner of Old Ridge Veterinary Hospital in Chaddsford, Pennsylvania. He's a practicing clinician and a member of the AVMA's Task Force on Emerging Technologies and Innovation. So he's bringing us really valuable frontline insights into what today's graduates need to succeed in practice. Next, we have Dan Thompson, co-founder and chief academic officer of Vet Ed Teaching Solutions and the assistant director of instructional design and faculty development at Oklahoma State University's College of Veterinary Medicine. Dan specializes in blending curriculum, technology, and learning science to help deliver data-driven, learner-focused content that prepares students for clinical readiness. Joining us as well is Corey Solomon Santone. She is the Director of Growth and Strategy at Enflux. Corey has over 2 decades of leadership in education, ed tech, and she helps institutions harness data and technology to improve learning, teaching, and ultimately student success. And of course, I'll be serving as today's moderator. Again, I'm Christy Chori, account executive at Enflux. My background spans nearly 20 years in education and program leadership, and I currently support health sciences programs in strengthening curriculum, effectiveness, and student outcomes. And of course, we're joined today by all of you. Towards that end, we'd love you to drop your name, your institution in the chat. We'd love to see who's here with us today. Before we get rolling, just a few housekeeping notes. All participants are muted during the webinar. That being said, your input and your insights are valuable, so please use the chat feature to provide feedback at any time. We'll also be fielding your questions for the Q&A portion of this from the Zoom webinar Q&A, so use that to submit any questions, again, at any time during the webinar, not just during the Q&A section. Following today's session, you'll receive a link to the recording as well as any additional resources. So keep an eye on your inbox for those later today. All right, let's dive in. So here's what we're working on today. By the end of this session, our goal is that you will be able to understand why the gap in between graduation and practice readiness is widening and what can be done to close it. We're going to explore how instructional design from Vet Ed Teaching Services and learning analytics, Enflux, can drive scalable, measurable improvements in veterinary education. We're also going to discover how data transparency empowers faculty to align curriculum assessments and assessments with real-world competencies, ensuring students are better prepared for practice. Ultimately, we're also going to gain a deeper understanding of immediate actionable strategies that your institution can begin implementing to create lasting improvements in veterinary education this semester. So as we get into it, a question for all of you out there, put it in the chat. What do you think defines a practice-ready graduate? Is it passing boards or is it something else? So let's talk a little bit more about the practice readiness gap. Dr. Tancredi, we've seen rising concerns. Clinicians, educators, even accreditors are asking, how can we better prepare veterinary graduates for the realities of clinical practice? And how do we move from well-intentioned curricula to real-world outcomes that matter? You work with both veterinary students and new graduates. And so can you talk about where do you see the biggest challenges in making the shift from classroom to clinical practice? And what do you think might be causing it?
Well, first, I do think one of the biggest problems is that the scope of knowledge has increased very dramatically. You know, the Merck Veterinary Manual is 1,000 pages longer. It's almost 50% longer than it was when I graduated 10 years ago, more than 10 years ago. But vet school isn't any longer, so we have to cram more, 50% more information roughly into the same amount of time. So the students are asked to learn at a faster rate. I also think we need to resist treating graduates as like a monolithic group. Vet Med has a rightly earned reputation for being a homogenous demographic. Um, but these are individuals. Some thrive on encouragement, some respond to challenge, and many need a combination of those things. And every new grad, soon to be new grad I've met has strengths and weaknesses, and they often reflect their own unique educational background and clinical exposure, which is not uniform. A lot of veterinary education happens um, outside of the classroom on rotations and summer experiences and that sort of thing. Um, I think we need to focus on helping students and young doctors grow into the profession rather than just arrive fully formed. Um, I think one of the biggest problems is that case exposure uh, varies dramatically. You know, my large animal rotation, I was busy dawn to dusk. In equine medicine, we were very slow. The end of my first year in practice, I had done a dozen foreign body surgeries, and it was years before I did a splenectomy. It's not a failure of the system. It's just the reality of medicine. Like and that in it inevitably creates a variability in readiness. Um, I think another dimension to this is the transition from a tertiary teaching hospital, like a tertiary care facility, staffed uh, by and large specialists and these really accomplished credentialed people, to the real world. In academia, a boarded surgeon correctly insists that the ACL injury can't be diagnosed without radiographs and should only be repaired with a TPLO. In private practice, I'll meet clients who can't afford the radiographs, can't manage an 8-week post-op recovery, or can't give meds post-op. And then you're talking about contextualized care that the folks who make it to that tertiary care facility, the clients who end up at the teaching hospital, have often already sorted themselves out. So I think there's a lot of that kind of thing that leads to the variability in readiness and exposure. And for that reason, we got to treat the new grads and soon to be new grads as individuals.
I think it's some really important insight. Do you have any specific techniques or strategies you use for helping new veterinarians or even student veterinarians kind of get used to this adjustment and making these on the ground decisions?
I tend to give a wide berth. I tend to give them a lot of latitude and support, right? Like my door's open, but I'm not standing over their shoulder. Um, and I think most of them try really hard and they really want to do a good job. Uh, they're part of being a clinician is finding the balance between, the humility that comes with not knowing things and not being able to, not being perfect, and not letting that turn into anxiety, and not letting the confidence about the things you do know turn into arrogance, and that leading to disaster too. Um, and both of those things can be just as dangerous to patients. Um, and finding that balance is important. I also think it's can be difficult for students um, because of the hustle culture, the like insane workload they're asked to burden. Recently, a veterinary school was in the news because their students had half the graduating class signed a petition, said they were consistently working 100-hour weeks, like consistently working 14 plus hours a day, 7 days a week. And, you know, we rationalize these things as a rite of passage, um, but they function less as education and more as exploitation. Uh, they, when we have these new graduates who associate vet med with exhaustion rather than growth, we create a workforce pipeline that's unsustainable, unstable. The systems that emphasize endurance over reflection produce clinicians who are hesitant to step into the role of a doctor and leader. Um, to that university's credit, when that story got traction and it was brought to the administration's attention, they implemented new monitoring, workload monitoring policies, hour monitoring policies. I haven't heard anything about the impact there, but the fact that they're looking to change it speaks to the fact that they're trying to fix it when they recognize they have a problem. So
Yeah.
if you don't know there's a problem, very hard to fix.
Yeah, I think you bring up a lot of really, just judging from the reactions from the chat, saw some heart emojis coming up there. We know you're out there, friends. So again, please use the chat, use those reactions. You are part of this conversation too in that way. And I think that actually brings us, it's a great transition to talk to Dan Thompson, because like you said, if you don't know it's there, right, then you don't necessarily know there's a problem. And everybody, it sounds like, is feeling the overwhelm, students, faculties, administrators. So Dan, you're the Assistant Director of Instructional Design and Faculty
Mhm.
Development at Oklahoma State University. You're also an NFlux user, and you're leveraging instructional design and data-driven approaches to create this learner-centered content, right, that treats learners as
Mhm.
individuals, and also to empower faculty. You're also recently launched Vet Ed Teaching Solutions
Mhm.
with the mission of, quote, revolutionizing veterinary education by fusing specialist expertise with the most advanced evidence-based learning science. So, golly, can you talk about your approach and how it translates this theory into practice?
Yeah, absolutely. First of all, thanks for having me, and I appreciate everyone joining us today. Yeah, so with Bill, I thought you hit the nail on the head talking about, that, and we spoke obviously a little bit ago, and the idea that the Merck manual being 1,000 pages longer than it was not that long ago. And I've heard other folks say our current veterinary students are asked to learn more information than any other veterinary student has previously. And so we do need to be uh, really building our course and learning modules with a purpose and understanding that efficiency is really important in student learning as well. So where we can take instructional design and really translate it into theory and then practice is creating for the most part, truly, it's through formative assessment. So those assessments that are for learning along the way to improve the learning process. So for the last, I don't know, 20 years, we've talked about student engagement, and we have a ton of data out of OSU right now that shows that when we engage students with course content, that it improves their performance on our summative exams, so those midterms and finals. And then we had to define really what student engagement is. 20 years ago when I was in grad school, like everyone thought, if we just posted videos online, that was super cool. Like the first time I remember logging into an online class and seeing my professor talking to me on my screen, that was like super neat and cutting edge. And then we realized as we've moved further and um, with the different tools that we have to engage students that was really, more or less just kind of an online lecture, and it was, no different than the in-person talk. So what we've been able to do through OSU and that what we've been developing through Vet Ed Teaching Solutions are true student engagements, which means through assessments, because what we're that engagement that really is the breaking point for getting students to learn and most importantly retain information long term is by asking them to critically think about the content. And so we talk a lot here at OSU about creating clinical thinking repetitions for our students. So whether that's as early as first year when we start to kind of provide some of the framework around that they're of a case, and especially as we get into third and fourth year. I thought what Bill said was a nail on the head that we experience a lot as far as like depending on what rotation or service you're on, you're at the mercy of what's presenting to that clinic. And so we can't, create the patients, right? We just can't manifest that these patients show up when our students need them. However, we can create the atmosphere for them to have these clinical thinking reps through creating formative assessment modules for students to complete. So what that really means is that we are creating modules for students, and this is really through, again, both hats I have on the screen right here, but through like Vet Ed Teaching Solutions, we are creating along with veterinary specialists modules that are meeting students where they're at by providing really supplemental materials to course materials that are those formative assessments. And through those formative assessments, students are able to apply, key content within the course,
get feedback, immediate feedback as well, which is really for anyone that works with giving students feedback, timing is of the utmost importance there. And then also the quality of that feedback is important too. Where no longer is it sufficient to say the answer was B and you got an 85%. We have to give them the why. And we also make sure we give them the why when they answer correctly as well, because we want to make sure that they're definitely understanding that information. So students are, again, thoughtfully engaging with course content, getting feedback, and we're also making sure that that engagement is in different modalities. So not just multiple choice. We do open-ended questions, fill in the blank, matching, sorting, whatever fits best with the content. So we want to make sure we work what's best with the content to apply that to the learners, and again, where they're at in the curriculum, whether it's preclinical or clinical. Now, the reason that, and that the main point that this is, and we've seen this specifically at OSU, where this is turned into improved student performance and retention on our exams, is because of always tell our students this is not to replace your study plan, it's to better inform it. So to Bill's point again, like there's a limited number of hours in the day, and students are asked to learn more and more and more information. And so what we're doing is at the completion of these modules, they're instructed to self-assess throughout the module to identify where they can better improve and focus on the opportunities that they can improve upon. And then from there, they can be more efficient in their study plan so that they're not necessarily spending a ton of time where they're already strong, and they can obviously focus on those areas where they have some weaknesses. And when they're able to do that, they're really able to see more gains in their performance. And finally, just kind of put a bow on all of this. This is all data driven. I mentioned there we have the data to show that it improves student performance, but even step one of this is data driven. So we don't as faculty and staff, even in this AI generation where we can, generate learning materials faster than we ever have in human history, we we still have limited hours of work and time in our day. So we look at student performance data. Chrissy has mentioned we're Enflux users. So we look at our performance data dashboards in Enflux, and we can identify very quickly the areas in which students are struggling as a cohort the most. Sometimes it's within the current year. Other times, especially if we're looking at beginning of the semester, we'll look back to the previous cohort year and just see the general trends over the years where we have content that is tripping up students. Not only can that help us make better decisions about as far as our curriculum is concerned, it also helps folks like me to identify those learning gaps to really focus in on where we can first start to create these different learning modules to target, student learning issues. And then so that holistically has become a game plan for us at OSU, and has really become the driving force with this vet ed teaching solutions to make sure that we're creating this content in a way that's, again, really helping students to identify their weaknesses, make a study plan, improve those weaknesses, and then retain information long term.
That's fantastic. Thank you for that. And can you just talk a little bit about how you collaborate with faculty to keep everybody in the loop when you're implementing these kinds of strategies?
Yeah, absolutely. So through faculty development, which is, on the screen is my title, what we do is we create very specific trainings for our faculty to help them to create either use teaching methods or create learning materials. Again, to best position their students to improve their student learning outcomes. Sometimes that this is preclinical and clinical. We work often with our clinical faculty, for example, into creating case studies to allow students to get those repetitions, to see more radiographs, to see more ultrasounds, to think critically more about, patients that have, that present with different issues, especially since, the patients present with different issues based on different times of the year, just how human illness is seasonal. So is, animal illness. For example, in Oklahoma in August, we'll see heat stroke. We're not going to see frostbite or anything like that. January, we're not going to see heat stroke. So we need to make sure our students are learning, consistently the same content throughout the year. So we're often training our faculty to be able to make those materials appropriately in a deliverable that's best for the student. And I think that's really important for anyone that's on with us today, is that when one of the ways that has really helped us to elevate the impact of the modules that we create for students is by using tools that help us as the creator to really control the flow through which students will go through the module. So just think like if you posted a PDF or a PowerPoint for students to review, and there's a case study, questions, whatever, it's human nature to go look at the end and find out what the answer is to the case and know, what the treatment plan is. For any of you that had the actual textbooks, if you're in our age range that we've already talked about at the beginning here, you know that like the odd numbers in textbooks and math books, the answers were always in the back of the book for the odd questions. I obviously got all those correct because I went and looked at the answer before I did the question. So, did I learn from those? Probably not. So what we do is we gate the information as students get that so that they don't see the differential list, for example, until they can provide their own differentials, so that they're, creating answers throughout the process and having to think critically before they get that feedback. And that's a big part of our faculty development effort here, is to work with faculty to design the modules in a way that are best for long-term retention.
Thank you so much. It's really exciting work that you're doing on your end, and I really appreciate seeing how you're drawing from both what faculty need and also all the data and the information you have on your students. And I think that's a great transition to talk to Corey, because Corey, you bring such a multifaceted perspective. You've served in as a classroom teacher, an administrator, an executive, even a board member, all in different facets of education. So you're really bringing a breadth of experience that comes with both insight and empathy when you're working with our customers, especially as a faculty member myself, being like, oh, here's another platform that we're gonna have to learn this year. And so it's kind of a two-part question. One is, how have you seen data transparency and learning analytics help and Flux partner institutions and the different constituencies within them succeed? And then we'll kind of go to the part two.
Sure, yeah, and thank you, Christy, for that kind introduction. What I've seen is that when data is transparent, everyone, so faculty, program directors, and students can work from the same picture, right? So faculty get clarity on whether or not they're truly teaching and assessing the competencies they think they are, especially as programs transition to this competency-based education approach. The leadership gains confidence that the program is aligned with the accreditation standards, and the students benefit through a more intentional feedback and support. So it's the data part of it. I always like to say it's a bit like students making flashcards but never reviewing them. The value isn't in just having the cards, it's in using them to guide practice. And the same is true with data. The power comes when we engage with it to make actual improvements.
Brilliant. I used to have I had a high school math teacher when we first got those graphing calculators who was like, this does not have a brain. It's only as smart as the person using it. And I think, because uh, there is such an opportunity to leverage this really powerful engine, you've done a lot, especially with working with our partner institutions, to make sure that they understand that they are the drivers of that change. The data is there for them. So where have you seen, or what have you found has been maybe a challenge with working with faculty and different stakeholders to unpack kind of where the real value is?
Well, I think faculty respond differently when data feels like a growth tool instead of a report card. So, framed that way, like analytics can highlight what's working and where students needs more support and give faculty the confidence to make changes without this fear of judgment. So, I would say an example about this analytics and how it can help with curriculum and assessment alignment, like Dan, you were talking about, is at one veterinarian program, the analytics showed that students were underperforming on competencies that were tied to clinical decision making and client communication, right? Which I think, Dan, you've shared with us as well. So faculty were covering these skills, but the skills weren't mapped or consistently assessed in a way that the program could really track easily. So once that gap was visible in their data, the faculty were able to embed more case-based learning and align their assessments to those competencies. And within one semester, they could already see improvement. And the conversation shifted from anecdotal to evidence-based, which we all know is important, and especially in terms of when you're trying to prove your compliancy with your accreditors. So I think, honestly, there's a story in data, but because it's in numbers, it can often be overwhelming. And if there isn't people, there aren't people with a skill set on your educational team to translate those numbers into the story that then faculty can easily use to actually make changes, or they can affect their teaching and learning, then there's a huge disconnect, right? So we're trying to bring those together.
I think it's a great point about remembering where the expertise, really lies, and where the action is happening, that faculty and clinical coordinators, right, are driving, and curriculum coordinators are driving this change. And when you have better data, and when you can create more efficiently create stronger tools, right, that allows you to focus on just doing your job really well, which is, I think, as an educator, what you sign up to do.
Right. And I think, Dan, to your point, the reality is there's only so many hours in a day. And so if it's not easy to do, it gets lost. It'll get pushed off someone's plate. And what I think, what I love about Influx, obviously, I'm biased because I'm in a part of this, but it, we're able to turn something really overwhelming into something manageable and repeatable, right? So all programs have data. It's just scattered across spreadsheets and Canvas or Blackboard or an ExamSoft and your accreditation binders, and technology like Influx can pull that all together so that faculty can see those patterns we're talking about in minutes instead of months. And because they're in the trenches, they can see the data and make change quickly instead of it being disjointed between several different people and reports and meetings that have to happen to make that happen. So it saves time. It strengthens your accreditation readiness. It gives schools a structure they can sustain year after year, and it can sustain through faculty and leadership turnover, which is also often a setback that we see happening. So it really makes continuous improvement possible instead of episodic.
Yeah, and just to add to that, Corey, too, when you're talking about like having spreadsheets, which always makes me cringe when I hear that word, even though I use them all the time. But when you talk about, spreadsheets and Canvas or Blackboard or ExamSoft or whatever else, taking the time on that, it takes away from the back end, which is making things actionable. So I know like when I have my data streams that I know I'm going to pull from, like I can actually do the actionable step to this, which is creating teaching methods or learning modules that actually will help students improve their learning outcomes. And so, with all of us, all of us are here for the reason of helping, students to become veterinarians, and for, my time with them throughout the curriculum, it's to help them to improve their learning outcomes year over year. And with that being our focus, when we can put something into action, really, that's the best situation we can be in to perform our best in our roles.
I agree.
Absolutely. And I do love, Corey, the way that you describe it. And I had to throw this in there because I love this visual. I think you explained it so well. But as I am a visual person, I also enjoy how this works. And so I'm curious for our participants, our folks out there in webinar chat land, how do you think faculty attitudes towards data might change if analytics were more frequently framed as tools for improvement rather than tools for judgment? I'm really curious to hear about your thoughts and your experiences. So we are going to move on to just a short roundtable discussion. And I would love for each of our speakers to share one immediate actionable strategy that institutions could implement this semester. Of course, as it is a roundtable, this is also a conversation and discussion. So again, folks in the chat, where do you see one actionable change that maybe your institution could enact this semester that would have that impact on student readiness? So the floor is open. Corey, Dan, Bill, floor is yours.
I'm always ready to talk. So, or you can go first.
Oh no, I don't mind. You go.
Are you sure? Okay. So for for me, one of the core instructional design elements that um, helps students to retain information long term is actually a really simple one that I love, and it's the idea that students will retain information long term by returning to content over and over again in different types of formats. And so that's something where if you were teaching tomorrow, for example, you if think about the content that you're teaching, and oftentimes it's very easy to lecture. I taught high school, I lectured all the time. It's the easiest way to get a lot of information out to a lot of people. But there are little ways to within your lecture where you can get students to start to critically think about the content as opposed to just trying to absorb it in class. So when you think about that from the learner's perspective, how can you get them to again, engage with that content in varied formats over again? What are ways that you can do? I've mentioned learning modules a few times. One fun tip that you can do tomorrow, ask when you're in a transitional period in your lecture, ask students to summarize in their own words the key points from the lecture up to that point. That helps them to start to turn your words into their thoughts, and that starts the long-term retention phase. So even from an instructional design standpoint, I think in 2025 we get very easily lost in um, tech and always trying to lean into tech tools. Obviously, AI is so huge right now, and I use that a ton myself. But there still are design-wise ways that we can impact learning again through those varied formats and of returning back to the content in a strategic way. So we want to have planned repetition and not redundancy.
Great. Thanks. Bill, do you want to talk?
I really love that phrase, planned repetition and not redundancy. That's a really powerful phrase. I think like to systematically build in those decision-making and communication opportunities. I think uh, making sure that we treat students like students and not, you know, indentured servants who are there to support a shortage of technicians or something else is really valuable. Like these are people who are paying to get an education, not to fill in a workforce gap. So I think, you know, I would rather err on the side of being too nice and too gentle and too kind to the students than err on the side of like, well, what if they come out and they're soft? And it's like, okay, well, they'll need less therapy later. That's okay with me. Like they'll make it, right? Like for a profession with, major league mental health issues and a very high suicide rate, I think it is the responsibility of educators and, clinicians like me too, to uh, be supportive and kind, and in any way we can manage to the students and the new grads and our colleagues.
Yeah, I think that's such an important point. There was a study released recently about kind of that, the two opposing mindsets that come out of either a like kind of punitively based approach to like you're not allowed to make a mistake in terms of health sciences, right? As opposed to kind of that more curiosity based mindset. And what the study basically ultimately found was the levels of burnout, not just clinical errors, but the levels of burnout and mental health issues among practitioners who are coming from that being trained in the like, if you make a mistake, you're dead to us kind of way versus, right? And again, possibly erring on the side of being kinder, being gentler, but in that curiosity-based mindset and the opportunity to encounter information in different ways, to try to apply skills in different ways, the outcomes are wildly different.
That was fun. That's powerful, right? So, I think my actionable strategy feels less exciting because it's maybe more about course like data, but
Mine was be nicer to people. That's yours has got
yeah.
to be more creative than that. Yeah.
No, I think that's better. I would like to say that's mine too. So I was gonna say one thing you can do is just pick one course this semester and map your assessments against your program's competencies. And so one simple dashboard or a simple spreadsheet that you review with your faculty team can surface where you're over or under assessing, and then that conversation alone can spark some real meaningful change. And while you're at it, be kinder to your faculty too, because they're juggling a lot, and that's a soapbox I'd like to be on. So and then a shameful plug is that the actual like easiest thing you could do to help yourself is maybe just book a call with me. And so we can talk about how Influx can support your program in the future because Dan loves us and Bill does not need Influx in his practice, but I'm sure you can love us too.
I don't, but I think you're swell. Like it looks like no, sincerely, it looks like really cool technology because you can't fix something if you can't measure it. And this gives a way to, intervene early. This is preventative medicine for academics.
Okay, so you're hired, and that's that's the best soundbite. We'll leave it at that.
So
Christy,
I think, oh, Dan, did you want to add anything? Okay.
No, I was just actually gonna say that they should hire Bill in marketing because that was brilliant.
Yeah. Sorry, he's our
All
new
right.
favorite.
Marie, our marketing team is on the call. I'm sure they
Yeah.
Thank you,
Yeah.
Bill.
So speaking of right, the knowledge and the expertise in the room, question to all you folks out there. If you had to pick one skill or competency that graduates must leave with, which would you choose and why? What is at the top of your priority list? And as you kind of think on that and maybe share with us, just to recap what we've talked about, right? The gap is real. It's real, but it is solvable. And we need that instructional design and we need that faculty support in order to make that happen. And as the complementing aspect to that, right, that data and technology management is how you can achieve that sustainable and even scalable improvements, like Corey said, right? It takes something that takes up so much time and stress, and it makes it manageable so that you just get to do your job, and you get to do it well informed, right? Again, you can't address it if you can't measure it. Now is also a time where we want to hear your questions. You can pop them in the chat and let us know what you think. I'm also curious, while we're looking for those to come in, Bill, where do you see your employees, your entry level folks who are coming in and working with you? Where do you what is there a certain characteristic? Is there a certain mindset, set of skills that differentiates the folks who tend to thrive versus folks who tend to struggle?
Um, I think it tends to have more to do with the emotional strength and maturity and in health and intelligence of the person than it does in their medical skills. Because the medical skill, like I really think medicine's not that hard for the most part. Like sometimes it gets real tough, but most of the time it's pretty straightforward, right? I think um the things that shake up students and really new grads are when a client is upset at a diagnosis, at an outcome, and the doctor is 100% correct. They did everything right and you get a bad outcome. And that is a thing that happens in complex biological systems. That is a thing that happens all the time, right? Like, I was, I talked to a client who was upset at another veterinarian from another practice because the enemas didn't work. And I looked up the papers for their obstipated cat, and I looked up the papers, and enemas have a success rate of like 52%. Like that's what there is. Like there's not a ton of better options. Like the doctor did everything right, it just didn't work. And that has the potential to really rattle some rookies. And you gotta that can be really hard on people. And that is not clinical competency based. That is one of the reasons you've gotta, emotionally, personally, professionally support your students beyond can you check the right box on a test.
Absolutely. I'm seeing we do have a question in the chat about the impact of workplace-based learning during the final year, and about opportunities for kind of bridging that gap. So I know from a shameless plug angle, NFLEX does have dashboards that help you monitor your clinical rotations with your preceptors. It gives you data, both the student data and preceptor and site data. So for example, if a preceptor is filling out the midpoint evaluation and the final evaluation on the same day, it might be worth looking into that, right? Or you might see that certain preceptors or certain sites are like the students who are coming out of those are really, really strong. So that's an opportunity to build momentum there. So that was something that came to mind for me, but I'm wondering if anybody else has any kind of insight or data on that.
That would be really useful. Like that NFLEX has a way that could be pointed at people like me who don't have like the background in education to kind of standardize and shape my responses to the students who come through here. Like that would make my life easier and probably make my feedback and their experience of it like a lot better.
Well, we are running up and we're about to be right on time because I know your time is valuable as at this time of year especially. So I really I want to thank you so much to our panelists, Dr. Tancredi, Dan, and Corey for sharing your expertise and insights. Thank you to everybody in the chat. I see some more comments about the generation gap that hopefully we can follow up on. You see 2 QR codes in front of you. If you'd like to get in touch with us at NFLEX, scan the one that's got the little NFLEX in the middle on the bottom right. If you'd like to get in touch with Dan at VetEd Teaching Solutions, you can scan that QR code there with his logo in it. You also have our email addresses. We'd love to continue this conversation. Right, like we talked about, closing this gap requires a blend of thoughtful design, of data-driven strategies, and really strong feedback loops. And when those elements come together, we can really better prepare our graduates to thrive in this profession. Quick reminder before we go, the session has been recorded, and so we'll be sharing the slides and resources with you after the webinar. Again, please do continue the conversation with us. You know how to get in touch. On behalf of our entire panel, thank you again for your time and engagement. We look forward to seeing you, and we look forward to seeing the ways that you put these strategies into place this semester. Take care.
Thanks, Christy.
Thanks, everyone.
Thanks, Bill. Thanks, Dan.
Thanks, everybody.
Thank you, guys.